Okay, so here are our healthcare vocabulary words. So the first word is vaccination. This is a noun and it means an injection or a shot to prevent infection by a disease. So the verb is to vaccinate and the noun is vaccination. And so many times you will see that schools require children to get vaccinations. The sentence here, some schools require children to get the measles vaccination before the start of the school year. So this is vaccination. The next word, copay or copayment. It's a noun. An amount of money a person with health insurance must pay at each visit to the doctor or when buying medicine. So this is the amount of money that, in addition to what your insurance pays, you have to pay a certain amount of money, and it's usually about $30, maybe $40. If you're lucky, it might be $20. But it's the amount of money that each visit you will have to pay to the doctor or specialist or to the pharmacy for your visit. So I have a $30 copay for my family doctor. Deductible. So this is a little bit different than a copayment. This is the amount of money you have to pay for something before the insurance company pays the remainder of the cost. And this is often something that happens on an annual basis, which means every year. I have a $1,000 deductible for my insurance, which means that for sometimes larger events, things like surgeries or if I have other expenses, I have to pay the first $1,000 and then beyond that, my insurance will pay the rest. So the cost of my surgery was $4,000, so the insurance covered the other $3,000 if I had a $1,000 deductible. Reimbursement. So this is a noun and the verb is to reimburse. So this is a payment to someone in the amount of money equal to that which they have spent. So it's basically getting paid back. You would see this word used in more formal settings like business or in this case healthcare payments. So you might request from your company reimbursement for an expense that you had. For example, I got a reimbursement from my company for the office supplies I bought with my own money. So you wouldn't necessarily use this word if you were asking for your friend to pay you back for something that you spent. The next word is fracture, and this is both a noun and a verb, and it means to break, and in this case we're talking about break as in a bone in your body. Pavel fractured his leg. It will take 6 weeks to heal. So talking about fracture and breaking a bone. Pre-existing condition. So this means that it is a medical condition, something like a disease or an illness that a person had before they enrolled in their medical insurance. So for example, Janet had diabetes for almost 30 years. So it is considered a pre-existing condition. When she went to sign up for her insurance, she already had diabetes, so it was pre-existing, meaning it existed before she signed up for her insurance. Optician. This is someone who sells glasses. This is a little bit different from someone who is an eye doctor. This is just someone who sells the glasses. So Mr. Banks is an optician at LensCrafters. I think they are having a sale this week. Checkup. So checkup is a noun. Just a quick note. Check up, as in two separate words, is a verb to check up on someone. And check up with a hyphen, so the check dash up is an adjective. But we right now are looking at the noun. So an examination by a doctor to make sure that a person is healthy. So you are not going to the doctor for any particular problem. You are just going to the doctor to get a general examination. Ernesto goes to his doctor for a checkup once a year. Out-of-pocket expense. So this is a medical cost that someone must pay themselves and is not covered by their insurance. So this is something that you would not get the money back or you would not get reimbursed for. We think about our pockets where we keep our wallet, which is where this expression comes from. And so you have to pay for it out of your wallet, out of your pocket, and you will not get the money back. So Enrique's insurance would not cover his surgery. That was an out-of-pocket expense that he was not anticipating. Referral. The act of sending someone to see someone else for advice or for treatment. So in the U.S. medical system, you have to go to your family doctor for most types of insurance to get a referral to go see a specialist. And so the doctor will write a referral, and now most referrals are electronic, so it can be sent through the computer, but before they were paper referrals, and you would actually have to take that paper to the specialist from your family doctor. And the family doctor, the actual name for them is a primary care physician. So this is a noun, the person's main doctor that they see for general questions, also called a general practitioner or a family doctor. So this is the person that you go to see if you have maybe the flu or a sinus infection or maybe a stomach virus. I went to see my primary care physician because I had a bad cough. She gave me an antibiotic. So that's the primary care physician. And the last word that we have is provider. So this is a noun, and this is the general term that we use for all of the people in the medical community that provide the services to the members. So someone who gives a specific service in the medical community, these are the doctors and other healthcare professionals. It is important to make sure that your healthcare provider accepts your insurance before you make an appointment. So now that you have the words, it is important that you go on to the website and you actually practice the words using the flashcards, because we will be using these words in the speaking section of this lesson. Happy practicing!